It is quite remarkable how often patients will tell me that either they weren't informed of this condition as a potential side effect, or the amount of information provided on this topic was just not in-depth enough. The education provided really needs to emphasize the fact that this side effect has potential long-term consequences on the patient's quality of life, and particularly if the education is not provided in the early stages. One of the most important things I'd like to make a point of in this video is acknowledging the fact that when you're a medical professional looking after cancer patients, I'm assuming that you have very limited time to cover all topics of importance in a great level of depth. So if radiation fibrosis is something that's going to happen down the track to the patient and you don't have time to go into an in-depth discussion with each patient on this topic, first and foremost, I completely understand, and I think the patients understand that as well. But if you don't have the time as a medical professional, then the next most important thing is to refer that patient on to another medical or allied health professional who does have the time to go into a deep discussion with the patient about it. I firmly believe that there are some topics, particularly in the context of breast cancer, that just deserve a lot more time than others. As an example, if you're a radiation oncologist or a radiation therapist or a nurse and your job is to go into detail about the burns from radiation as a potential side effect, consider the amount of time you give to the patient detailing that information. Now also consider the fact that that as a side effect potentially only lasts 2.5 to 3 weeks as a possibility. When you talk about radiation fibrosis as a chronic problem from radiation therapy, this could be lifelong for the patient. Some of the patients I see with this problem have had their radiation therapy 15 and 20 years ago, and they are still suffering the consequences of this problem. There's a reasonable amount of research, if you look into it, that's been done on radiation fibrosis. It acknowledges the issue. Research has found ways to measure the issue. It states the impact on the quality of life. The research also advises on treatment techniques such as physical therapy or physiotherapy treatment like scar massage, Mobiderm, and other modalities that I'm going to go into a little bit later in this video. So this is a product developed in France. It's not available in every country, unfortunately, but it is literally foam pieces stuck between 2 bits of hypoallergenic tape, and it can be worn directly against tissue that's had radiation fibrosis. The other exciting product that's come onto the market quite recently is from Haddenham Healthcare, which is the Comfortwave breast band. This product is a breast band, as you can see, that literally is worn over the chest wall if you've had mastectomy or over the breast if you've had a lumpectomy. So it's quite stretchy, as you can see, and the technology in the fabric, which is designed in Japan, is designed to break up fibrotic areas of tissue and enhance lymphatic flow.